page 617, this whole chapter and this whole test is about parasites. So page 617, general concepts in parasitology. So we're going to talk about the collection, the handling, and the transport of parasites. You go 3 lines down. The stool should be delivered to the laboratory as soon as possible after collection, or if it's placed in a preservative. Trophozoites, which are the motile and reproductive form of amoeba or eggs of some helminths, may disintegrate if it's not preserved or examined within a short time. Go 3 or 4 lines down. For optimal detection of intestinal parasites, a series of 3 stool specimens collected a day or 2 apart within a 10-day period is recommended. Underline 3 stool specimens. Because what it might be is that when they go to the bathroom, they might not shed any of the parasite in that one particular one. But if you do 3, you're more than likely to recover a parasite if they have one. So turn the page. Preservation. And so when a person gives a stool sample, if they can't bring it immediately, they can put it in the refrigerator for 24 hours. But after that, then it needs to go in a preservative if they can't. Because a lot of times now, hospitals will send out for parasite detection. And so if they do that, obviously it takes a day or 2 to get to the reference lab. So they'll put it in a preservative. So if you go to like the second part of preservation up at the top, so where it says polyvinyl alcohol in bold, it's a 2-vial system using polyvinyl alcohol or PVA for 1 vial, and then formalin, 10% formalin in the other vial. So usually it's actually, especially if you're sending out for a culture also, it's usually a 3-vial system. 1's for the culture, and then 2 are preservative for parasites. And the 2 has PVA in it, and then 1 has formalin in it. So go to the macroscopic examination. So this is just looking at it with your 2 eyes without a microscope. The examination of an unpreserved stool specimen should include a macroscopic and a microscopic exam. During gross examination, intact worms or proglottids. So if you ever hear the term proglottid, that means intact worms. Okay, so it literally looks like a worm. Okay, can be seen on the surface of the stool. So that's called proglottids. Gross examination of the specimen also reveals the consistency of the stool sample. Consistency meaning it's liquid, it's soft, it's a formed stool, whatever. So whenever you're doing a macroscopic exam, you're looking for proglottids or intact worms, and you're looking for the consistency of it. Is it liquid? Is it formed? Is it hard? Is it soft? The color of it, you're looking at that. Because a lot of times for C. diff, which of course is a bacteria, not a parasite, if it is not liquid stool, they will not do a C. diff on it. And rightfully so. If you have C. diff toxin, it's going to cause you to have diarrhea. You're not going to have a stool like it's hard as a rock and have C. diff. That don't happen. So that's just wasting tests, essentially. So they look at the consistency of it. So no eggs, you can't see eggs or anything like that by looking at it macroscopically. That's just looking at it, okay? Go down to the next paragraph. During gross examination, the color of the stool is also noted. A normal stool usually appears brown. Stool that appears black may indicate bleeding in the upper GI tract, whereas if you have fresh blood, it may indicate bleeding in the lower GI tract. Any portion of the stool that contains blood or blood-tinged mucus should be selected for wet mount preps and placed in a preservative. Go down a couple, or no, sorry, the next sentence. A form stool specimen should be examined within 2 to 3 hours of collection if held at room temperature. However, if it must be delayed, you have up to 24 hours after passage of the specimen if it's placed in the refrigerator. So we'll start by that. So if they cannot or don't want to put it in the refrigerator, because let's just face it, that's not, you're thinking about putting poop in there right by your fruits and veggies, right? And that can be a little bit nasty, especially to people who aren't used to especially to people who aren't used to stuff like that. Me, I'm so used to stuff like that where that does not bother me. Okay. I have had me or my husband collect something, whether it be poop or pee. I'll put it in like a Walmart bag and stick it in there right next to my strawberries. Okay. That don't bother me. But that's just, it's not kosher for some people. So if they don't want to do that, then of course they can bring it straight to the lab to be examined. But if you're collecting 2 or 3 at a time, and let's say you live 30 minutes from the hospital, you don't want to run up there every hour and take the stool specimen, right? Or you might keep it in the refrigerator while you collect your other ones. You get what I'm saying? So, but after 24 hours, if it is placed in the refrigerator. So go to wet mount preparation. So this part is a microscopic exam. The direct wet mount of unpreserved fecal material is primarily used to detect the presence of motile protozoan trophozoites in a fresh liquid stool or from a sigmoidostomy material. Go down 4 lines. A portion should be placed in a fixative such as PVA so that permanently stained smears for definitive identification can be made. Go to concentration techniques. Concentration techniques are designed to concentrate the parasites present to a small volume of fluid and then remove as much debris as possible. Fresh or formalin preserved stool specimens may be used. The concentrate sediment may then be examined unstained or either stained with iodine. Protozoan trophozoites do not survive this procedure. Protozoan cysts, helminth larvae, and helminth eggs can be detected using this method. Sedimentation and flotation methods, both of which are based on the difference in specific gravity between the parasite and the solution, are used to concentrate parasites into a small volume for easier detection. And if you go down to the next paragraph, the zinc sulfate method is used for the flotation procedure. Go down to the next thing, permanently stained smears. Permanently stained smear preparations for all stool specimens should be made to detect and identify protozoan, trophozoites, and cysts. Go to not the next paragraph, not the next paragraph, but the next where it says all permanently stained smears. I'll see that. So this is just using a stain, kind of like doing a disc where you're staining, cells. You're using a certain type of stain to stain poop, which it's usually like something called a trichome stain or an iron hematoxylin. It just depends on what your facility does. And your facility might not even do staining. Okay, a lot of people around here don't. They send it out. But anyway, so all permanently stained smears are examined first by scanning using low power magnification. So usually your 10 or your 40, mainly your 40. And then once you look at those areas, they should be selected and examined under oil immersion, so your 100 objective, for the identification. So you'll use your 40 to scan, see if you see anything, and then to positively identify, you will use your 100 times oil immersion. Make sure you know that. The next paragraph, a modified acid-fast stain. So we just learned about acid-fast staining for TB, but it says the Kenyon modified acid-fast stain is used to detect oocysts of Cryptosporidium, Cytospora bailey, and Cyclospora cayennensis. With this procedure, the oocysts appear as magenta-stained organisms against a blue background. Because what are the three stains with acid-fast stain? Huh? Carbonyl fusion, acid alcohol, methyl and blue. So the actual cyst will appear that magenta pink color against a blue background, okay, because of the methyl and blue. And then the carbonyl fusion. Carbonyl fusion is like a red pink, okay. So the cyst will stain pink and you'll have a blue background. And it's for oocysts, specifically like Cryptosporidium. So put a star by that for oocysts, a modified acid-fast stain. And we're going to look at that in a minute, if we get to it today. We might not get to it today. So to know what I'm talking about, turn real quick, hold your finger right there and turn to 653. And look at figure 28.37, blue background and the cyst stained pink. I'll see that. And that's for Cryptosporidium. Put a star by that picture. Blue background, pink oocyst, Cryptosporidium, acid-fast stain. Absolutely. Definitely having pictures of the cyst. Do it. And now if you turn back. Other specimens examined for intestinal and urogenital parasites. My favorite one to talk about. The cellophane tape preparations for pinworms. The life cycle of the pinworm, Enterobius vermicularis, includes migration of the female from the anus at night to lay eggs in the perianal area. Therefore, a fecal specimen is not the optimal specimen for diagnosis for infection of pinworms. Instead, the cellophane tape preparation is routinely used for the detection of suspected pinworm infections. Put a star by that. This procedure involves swabbing the person's perianal area. So perianal area is your butthole, okay? You did not know. Swabbing the person's butthole with a tongue blade. So when it says tongue blade, it's like little tongue blades, like that you say, have little popsicle sticks. With a tongue blade covered in cellophane tape, sticky side out. So in other words, you're literally going to go on the person's butthole with tape, okay? The collection should take place first thing in the morning before the individual uses the bathroom or has been bathed. After the sample is taken, the sticky side of the tape is placed on a microscope slide and scanned at low and high power magnification for the characteristically shaped eggs. So now hold your hand right there and turn to 668. This is what an Enterobius vermicularis egg looks like. It has like a center portion that's like grainy looking, and then has like a smooth outer portion, and it's like football shaped. Mm-hmm. So this, you can see this is not stained. So this is just looking at it under a bright field microscope. And that's it. 40 times magnification. Right there. So to start by that, you need to know what it looks like. You do not examine stool for pinworms. And pinworms, we're going to talk about them in a little while, but they're common in kids, okay? And you get them from like dirt and stuff like that. So the kids who, you know, go outside and play all in the dirt and then don't wash their hands and then put their hands all in their mouth and blah, 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 blah. That's how you get pinworms. And they come out mainly at night to lay their eggs around the booty hole, and they'll even hatch there. And then the person starts itching, okay? Like I said, it's mainly kids, okay? And then that's how you do it. Stick a little tongue blade, put some tape on it, right up to the butthole, and then we eat it. Go to urine, vaginal, or urethral specimens. Eggs of Schistosoma hematobium and Enterobius vermicularis. So Enterobius vermicularis is also pinworms. It can also be detected in urine too, especially with children because it's all kind of right there connected, right? So Schistosoma hematobium, Enterobius vermicularis, and the trophozoites of Trichomonas vaginalis can be detected in the sediment of urine specimens. We know that. The next one, sputum. In cases of Strongyloides stercoralis, faleriform larvae may be seen in a direct wet mount of sputum. Eggs of the lung fluke, Paragonomius westermanni, can also be identified in a sputum wet mount. And if a patient is suspected of having a pulmonary abscess caused by Entamoeba histolytica, then the sputum can be examined as a stained smear. So we're going to learn about each of these, and you'll know that each of these are pretty much found in the sputum, except Entamoeba histolytica could be different places. Blood smears. What do you think we're looking for in blood smears? What is malaria? Is it a parasite? Yes. Yes. Where does it show up at? Which cells? Red cells. What about Babesia? Red cells. Okay. What about Trypanosoma cruzi? Those were the worms. I remember them. Okay. Examination of blood smear stain with Giemsa or Wright stain is the most common method of detecting malaria, Babesia, Trypanosoma, and some species of microfilaria. Although motile organisms such as Trypanosoma, Trypomastigotes, and microfilariae can be detected on a wet prep of fresh blood specimen under low and high power magnification, identification is made on the basis of characteristics seen on a permanently stained smear. Go down 3 lines. Tissue parasites, such as Trichinella spiralis, Leishmania, and Toxoplasma gondii, can be identified by examination of a tissue biopsy. Go to collection and preparation. Blood taken from a finger stick, or really a vein, is the best specimen for malarial smear because it tends to give the best staining characteristics. Blood collected in EDTA gives adequate staining if processed within 1 hour. Go to the next paragraph. For suspected cases of blood parasites, a thick film and a thin film should be made. Go to the next paragraph. A thick film is best for the detection of the parasites because a larger volume of blood and the fact that the organisms are concentrated to a small area. Go down. Eight lines down, 9 lines down. Initial scanning. Y'all see that? Initial scanning of the stained smear at 100 times magnification detects microfilariae. The thick smear is examined at 100 times for the presence of malarial organisms. Go to the next paragraph. The thin film is made in the exact same way as that as a differential cell count. So in other words, you'll just make a slide. Okay, you'll make like a differential slide, like you're about to count a diff. Okay, that's the thin film. The thick film is literally taking like a drop of blood and dropping it on. That's thick, right? The thin, you spread it out. That makes sense? It should be fixed in methanol for 1 minute and air dried before staining with means of stain. The next part, is talking about immunologic diagnosis. So we, know that you have kit tests for different, different specimens like Giardia and stuff like that. So, and mainly that's what, labs are doing around here is they're kit testing stool for parasites. They're not doing a stain smear and stuff like that. So they're just doing a kit test. It's very easy, it's pretty accurate. Instead of doing the smear because the smears take a really long time. So you can also have fluorescent antibody techniques and of course molecular methods like PCR. So now let's start talking about these wonderful parasites. So protozoa, so intestinal amoeba. In general, amoeba present the most difficult challenge regarding the identification. Their average size range is smaller than that of other parasitic organisms, and they must be distinguished from artifacts and cells that appear similar. Go down to Entamoeba histolytica, this bar and the other one. So Entamoeba histolytica and Entamoeba dispar are morphologically identical. Turn the page. Nine lines down where it says the pathogenic organism. Y'all see that? The pathogenic organism is continued to be referred to as E. histolytica. So even though they look the same, their antigen expression is different, but the main one that continues to be pathogenic is Entamoeba histolytica. Go to clinical infections. So that's the main one that we're going to talk about. Entamoeba histolytica normally subsists on intestinal bacteria and partially digested food of the host. Go to the next paragraph. The host secretes pro-inflammatory cytokines, leading to an acute inflammatory response and the migration of neutrophils and macrophages to the tissues. The organism can also secrete chemoattractants for neutrophils. Go to the next paragraph, or not the next paragraph, but the next where it says E. histolytica infection presents in several ways. Asymptomatic amoebic dysentery or extraintestinal amoebiasis. Everybody's heard of amoebic dysentery, right? Yeah, no? Have y'all seen Miss Doubtfire? Miss Doubtfire? With Robin Williams? I just watched it. What?
What fire?
Mrs. Doubtfire.
I've heard it, but I've never watched it.
Mrs. Doubt, like I doubt it, Doubtfire.
What is that?
I've heard about it, but I've never watched it.
Obviously, we are like ancient. Okay, that's gonna be like one of your homework assignments is to go watch Miss Doubtfire with Robin Williams. Robin Williams, the comedian.
Is that man?
Yes,
Did he die?
he committed suicide.
Did he play Theodore Roosevelt in that movie? Yeah. So you don't
I
know?
think so. Glover, he played Glover in Glover.
I don't know names on that.
Captain Hook. Oh my God. Miss Doubtfire is like A1. It is so funny. It's so good. It's one of his best that he's ever done. Oh my gosh. Okay, well I can't make this. You'll just have to watch it then. Anyway. Yes, where he dresses up as a woman. Yeah. It's so good.
I've heard about it.
Oh, y'all need to watch it. Anyway, go down from there 7 lines where it says in acute infections. The patient may experience vague abdominal symptoms such as tenderness, cramping, fever, up to 20 diarrheic stools that contain the trophozoite blood and mucus. Some stools contain Charcot-Leyden crystals, which are breakdown remnants of eosinophils, because eosinophils are elevated in what? Parasitic infections. And their presence in the stool is suggestive of an intestinal parasitic infection. Go to lab diagnosis. Patients with diarrhea are most likely to have trophozoites in the stool that may be seen in direct mounts or trichome strain smears. Turn the page. So if you look at table 28.3, the comparisons of amoeba, what you're mainly going to see are the cysts. If you happen to look. And so if you look at Entamoeba histolytica and look under cysts, you'll see chromatoidal bars. Y'all see that? Chromatoidal bars put a star by rounded. They will have rounded chromatoidal bars. And if you look the next page real quick at figure 28.4, you see that cigar-shaped bar in there? Everybody see that? That's what it is. It's rounded. So it's like looks like that. Looks like that. Round in chromatoidal bars. You need to know that for Entamoeba histolytica. Then for Entamoeba coli, go to where it says number of nucleoli in a mature cyst. You're going to see around 8. Put a star by that. So under number of mature cysts. So Entamoeba histolytica and Entamoeba coli are 2 of the main ones. And so kind of to tell them apart, you're going to be looking at their cyst stage. And for Entamoeba histolytica, if you'll look at that drawing right there, you see 4 nucleoli or 4 nuclei with that round chromatin bar. Y'all see that? And then with Entamoeba coli, you will see 8 nuclei. And usually the chromatoidal bars and them have splintered ends, like in that drawing. Y'all see that? So Entamoeba coli, 8 nuclei with splintered ends. Entamoeba histolytica, 4 nuclei, rounded chromatin bars. Then on page 627, just saying again what I've said, the cytoplasm may occasionally contain chromatoidal bars composed of ribonucleic acid, so RNA. The chromatoidal bars are cigar shaped with rounded ends for Entamoeba histolytica. Turn the page, Entamoeba coli. You get it, the ingestion of cysts in fecally contaminated food or water. Go to the next paragraph, put a star by this. The mature cyst has 8 nuclei. Mature cyst, 8 nuclei. 5-line sound. Chromatoidal bars, when present, have a pointed, splintered appearance. So those are 2 of the main amoebas that you need to know. Now turn to page 630. Tissue amoebas. What's one tissue amoeba? Tissue, any tissues, but this one specifically targets your brain, that we have talked about. Neisseria fowler. Yep, brain-eating amoeba. Okay. So tissue amoeba. Free-living, thermotolerant amoeba can tolerate a wide range of temperature, pH, and salinity. They're found in soil and water and usually feed on bacteria in the environment, but are known to cause human disease. They gain access to the CNS by inhalation in the upper respiratory tract, followed by penetration of the nasal mucosa, which then allows them to travel along the olfactory nerve to the brain. Although the number of infections caused by these organisms is low compared to those with intestinal protozoans, they're very difficult to diagnose and treat and are associated with high mortality rates. Neisseria or Naegleria fowleri and Acanthamoeba species have been recognized for many years as the amoeba most commonly associated with CNS invasion in humans. The press sometimes referred N. fowleri as the brain-eating amoeba. Go to the top of the next part. In addition, Acanthamoeba has been linked to amoebic keratitis in soft contact lens wearers and with cutaneous infections in patients with AIDS. So that's why they tell you you need to change your contacts out and your contact liquid out, because people can get parasites on the contact lenses, which then go to your eye. So Neisseria fowleri or Naegleria fowleri. Go 4 lines down. In the U.S., PAM is most frequently reported in Texas, Florida, Virginia, and California, but have been reported as far north as Minnesota. It occurs in healthy, immunocompetent children and young adults with no predisposing condition. A common factor in the infection is the report of swimming or other water-related activities in warm artificial lakes or brackish or muddy water, or exposure to bottom sediment. Water skiing, wakeboarding, and other activities will increase the chances of forceful entry of water into the nose. So a lot of people that are swimming in these freshwater lakes, they'll jump in, not hold their nose, it'll go up their nose, get on that lining of their nose, get that olfactory nerve, and go straight to the brain. Okay.
I said, I'm surprised I haven't got that yet.
Go down a little bit more. In recent years, there have been several cases related to sinus irrigation using tap water. So anybody using a neti pot, okay, where you squeeze the sinus stuff, I use a neti pot too. It's like the best ever. It's the best. But you'll squeeze it up essentially, and it comes like so. Cleans your sinuses out with mucus and dirt, and it comes back through the other nostril. You've never seen that? It feels weird, but afterwards you're like, I can breathe. Like it just cleans out like, and I do it after like cutting grass and stuff like that, because if not, I always get sick. But you just you hold like this nostril essentially, put it, like squeeze it, and it goes up, and then you let it out, and it goes. You've never seen on TikTok some babies getting it done? Yeah, I've usually used the bottle, but there's also like it's called a neti pot, where it's like, it looks like a pot. Where you,
That's all I ain't seen it, 'cause if there's anything to do with snot in your nose, I'm turning it. I think.
you feel better afterwards. But anyway, so it says using tap water, okay? Well, it tells you whenever you're using one of those to use distilled water, or if you're going to use tap water, to boil it, okay? Because tap water can contain stuff, all right? And so people have gotten this using tap water, just using tap water right out of the sink, and of course, that's straight access. So it says whenever you're using neti pots or sinus rinses, to either use distilled water or boil the water so that it'll get rid of it. Next paragraph, 4 lines down. The trophozoite enters the nasal cavity through inhalation of contaminated water or soil. The amoebic form colonizes the nasal cavity, invades the nasal mucosa, attaches to the olfactory nerves, penetrates the cerebriform plate, moves along the olfactory nerve to the bulb, and moves to the arachnoid spaces. And then from there, it's free to spread throughout your central nervous system. Infections are thought to be related to inhalation of a large number of organisms, or either forceful entry of water into the nose, and the virulence of the strain. So clinical infection. Clinically, the disease cannot be distinguished from bacterial meningitis. Incubation is usually 2 to 3 days, but it can range up to 2 weeks. Initial symptoms: severe bifrontal headache, fever, stiff neck, nausea, vomiting. Your CSF will show evidence of increased intracranial pressure, increased neutrophils and protein, and decreased glucose levels. Get a little bit more. The organism multiplies in brain tissue, and within 2 to 4 days, the patients experience drowsiness, confusion, seizures, and progress to coma, and it's usually fatal within 1 week. Go to the laboratory diagnosis. It can be made finding motile amoebic trophozoites in CSF. Acanthamoeba on the next page. You look up at the top of the next section, it says amoebic keratitis is associated with acanthamoeba. Individuals who wear contact lenses, especially the soft or extended wear types, are a primary at-risk group. That would be me. Ciliates. The only ciliate is Balantidium coli, B. coli. It is considered pathogenic for humans. Pigs are the natural host for this organism, and humans serve as the accidental host. The organism lives in the large intestine, where it causes mucosal lesions. Most people with this infection are asymptomatic, but it can cause self-limiting diarrhea and nausea, vomiting, abdominal pain. So it is the only ciliate, Balantidium coli. Go to the pathogenic intestinal and urogenital flagellates. For this chapter, what I would do is I would outline, I would put like amoeba. Put your Entamoeba histolytica and all that in there, and then put tissue amoeba. Still under amoeba, but tissue amoeba, Neisseria thalieri, acanthosis, or acanthamoeba, and then put what it is or whatever, the stuff I've read that might be important about it. Ciliates, B. coli. Pathogenic intestinal or urogenital, blah, 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 however you want to do it. To me, it just is better if you do it that way. Well, the flagellates constitute another major group of parasites that can inhabit the intestinal tract. The life cycle is relatively simple, resembling that of amoeba. Most flagellates have both cis and trophozoite stages. So Dientamoeba fragilis, Trichomonas vaginalis, and Trichomonas hominis, they lack a cis stage, and the trophozoite of these organisms serves as the infective stage. Go to the next one. Next page, 634. Giardia, duodenalis, which is also Giardia lamblia. Go to Giardia. Giardia is a worldwide distribution and has frequently been identified as the causative agent of outbreaks of gastroenteritis and traveler's diarrhea. It is the most commonly reported intestinal protozoan in the U.S. 4-line sound. The main group at risk for infection are travelers returning from endemic areas, hikers who drink untreated water from streams, and children in daycare centers. Travelers in areas with poor sanitation are often exposed to conditions in which waterborne or foodborne cysts are ingested. They can be, if you go down a little bit more, they are somewhat resistant to chlorine, but they're susceptible to heating to 50 degrees Celsius. Care about that part. Go down to the next paragraph. 5 lines down. Children younger than 5 are at risk for infection. They cause outbreaks of diarrhea in nurseries and daycare centers. Along with Entamoeba histolytica, Giardia has been identified as a sexually transmitted pathogen among those who practice oral anal sex. Go to up at the top. Infection manifests itself as self-limiting diarrhea, malaise, cramps, nausea, abdominal tenderness, explosive, foul-smelling, non-bloody diarrhea is present. Go down to lab diagnosis. Three lines down. 4 lines, sorry. Giardia lamblia is pear-shaped or teardrop shaped. They show a characteristic falling leaf motility on a wet mount. In a permanently stained smear, it's been described as having an old man appearance. So if you turn the page real quick, not really a great picture, but figure B, you see it's pear-shaped. It is a flagellate. It has flagella at the bottom. And then you'll see, if you go like this with your book, you can see it better. It has like 2 eyes, looks like eyeglasses. Said it looks like an old man. Huh? Kind of. Not really. If you look at the table on 28.5, so Giardia, duodenalis, or lamblia, whatever, you see that it is pear-shaped, and you see the flagella on it, right? Okay, motility, falling leaf motility. Other features, it has a sucking disc on it. So, in other words, that sucking disc sucks to the mucosa of the lining of your intestines. That's what makes them very sick. An old man appearance, because it looks like it has glasses. Some of these pictures in this book suck. This is a really good, really good one. So you see the cilia, the flagella, the flagella. You see it's pear-shaped. It literally almost looks like 2 eyes, nose, and mouth. So old man appearance. That's another one too. I mean, it's zoomed up, it's zoomed, but you can see it. Yes. And now turn to the page, turn the page to 636. Trichomonas vaginalis. So we know about this one. It is a pathogen of the urogenital tract in men and women. So it comes from the urethra of males, okay, because that's their urogenital tract, and from us, the vagina, okay. It causes trichomoniasis, which is one of the most common non-viral sexually transmitted diseases. Go up at the top of 637. Humans are the only host, and the presence of infection with the organism is associated with other STDs, especially gonorrhea. But just because you have trick doesn't necessarily mean you have gonorrhea. It's just that you see them a lot together. Trichomoniasis has been increasingly associated with adverse pregnancy outcomes, including transmission of the organism to the newborn, in addition to cervical neoplasia and pelvic inflammatory disease. Go to the next paragraph. In women, the infection is primarily localized to the vagina, resulting in itching and the production of a frothy, creamy, mucopurulent vaginal discharge. Go down 3 or 4 lines. Men infected with Trichomonas vaginalis is usually asymptomatic, and they're the ones that serve as carriers. However, they can develop a discharge. It is now considered an important cause of non-gonococcal urethritis. Infections in women and men are usually treated with metronidazole, which is Flagyl. 5 lines down. It has 4 or 6 lines. It has 4 anterior flagella and an undulating membrane that extends half the length of the body. In a wet mount, it has a jerky motility, and the motion of the flagella and the undulating membrane may be seen. So if you turn back to 635, and you're looking at that chart, Trichomonas vaginalis. Okay, you see the flagella at the top. That undulating membrane is that blue part right there that's going down. Jerky movement. It can be found in urine. Trichomonas hominis is another one. It is also jerky. And you won't really know which one it is by looking at it. You just call it trick. Turn the page to blood and tissue flagellates. So Leishmania and Trypanosoma, they differ from the intestinal flagellates. These are transmitted by insect vectors. So blood and tissue flagellates are transmitted by insect vectors. So go to Leishmania. Do y'all remember talking about Leishmania? Yeah. So the genus Leishmania contains several complexes of at least 20 species that cause disease in humans. Go a little bit more. Leishmaniasis is a zoonotic infection in which dogs and rodents serve as the primary reservoir hosts for all species, and humans are an accidental host. The insect vectors are sand flies. Clinical infections, they range from single self-healing skin ulcers to visceral disease affecting multiple organs. Go to, not the next paragraph, but the next, the most severe infection. The most severe infection, visceral leishmaniasis or Kala-Azar, is endemic in South America, Africa, Southern Europe, and Asia. It affects, if you go down a little bit, it spreads through the lymphatics and invades organs of the reticuloendothelial system, including the liver, spleen, lymph nodes, and bone marrow. Go to life cycle. When the female insect takes the blood meal, she ingests the amastigote stage. The parasite will then develop as a promastigote in the gut of the insect, and then it migrates to the salivary glands when it's mature. Then it is transmitted to humans through the salivary glands of the insect when it takes the blood meal. So when it bites you, when the sandfly bites you, it is in the saliva and then is then transmitted to you. It is inoculated into the dermal epidermal junction, so your skin, and is taken up by phagocytosis by a macrophage. Within the macrophage, it converts back to a mastigote stage and then multiplies within the cell. When the cell ruptures, the mastigotes are released and will invade other macrophages, and then the process keeps going, okay? Parasite and immune cell interactions can lead to inflammatory responses that control the parasite, but also cause tissue damage. Trypanosoma. I remember trypanosoma. Trypanosomes are blood and CSF flagellates that require an insect vector. Trypanosoma brucei and Trypanosoma brucei are the causative agents of African trypanosomiasis, commonly called sleeping sickness. The tsetse fly. Underline that, tsetse fly. Underline sleeping sickness. The tsetse fly is the insect vector. West African sleeping sickness is caused by Guambiense. It is more common, milder, and more chronic of the two. East African sleeping sickness is caused by Rhodesiense. It is a rapid course resulting in death within 6 months. And y'all remember what the American one is? What it's called? Yep. Go down to the last sentence. Trypanosoma cruzi. Underline that. Read on.
Looks like a shiny rose or something.
That's BB. That's Bluetooth.
Oh, that's right.
They look like worms in the blood. Anyway, so Trypanosoma cruzi, underline that, which is the cause of Chagas disease, underline that. Oh, Chagas disease, underline that. Go to lab diagnosis. The diagnostic stage in humans is the trypomastigote, which is seen in a right-stained blood smear. So if you look at figure 28.25, it literally looks like a little worm on the next page. But it's sorry about that. You should know that. So now if you go back to page 640, go to Trypanosoma cruzi. Chagas disease is a zoonotic infection found primarily in rural areas of Mexico, Central and South America. It is caused by Trypanosoma cruzi, transmitted by the triatomid bug, which is also known as the kissing bug. If you see this bug, it also looks like a stink bug. Y'all remember looking at that? I think it was in serology that we looked at it, or it might have been in hematology, because we went over this in hematology also. We went over this, you should know this, because this is the third subject we covered it in. But anyway, it looks like a kissing bug, and so do y'all remember a couple years ago that it come out and people were saying, oh my gosh, it's a kissing bug, blah, 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 but it wasn't, it was just a stink bug. Y'all remember that? Anyway. Next paragraph. Insect transmission is most common. It can be transmitted via blood transfusion, transplanted organs, and congenital infection. Go down to like the last couple of sentences. Screening of blood donors for antibodies to T. cruzi has decreased the rate of transfusion-related transmission. Screening tests for blood donors in the U.S. has been implemented. Trypanosoma cruzi, Chagas disease, sleeping sickness, looks like a worm. And if you go to where it says on 642, lab diagnosis, the primary stage is in blood during acute infection. It is elongated that appears as a C or U shape. So if you look back at that picture, you see it is in a C or U shape. It's like a little worm. So now, Plasmodium. Plasmodium causes what? Malaria. Yes. You have Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium falciparum, which is the worst one. Which one? Falciparum, yes. Go down a little bit more. Between 1 million and 2 million deaths occur annually, primarily as a result from P. falciparum. Go to the next paragraph. P. vivax is the widest geographic distribution and is more likely to be found in temperate climates. So P. vivax and P. falciparum cause more than 95% of infections. Clinical infections. Although malaria is usually transmitted through the bite of an Anopheline mosquito. Anopheline mosquito. Transmission through blood transfusion or infected needles has been reported. Transplacental infection has also been documented. if you just read, you can just read the next little bit. It's talking about the symptoms: headache, bone pain, nausea, flu-like symptoms. You get exhausted and sleepy. You get anemia. Um, keep on going down. It says the most severe form is caused by P. falciparum. That's like a couple paragraphs down. On the right side, second paragraph.
What now, the
Severe form. You can read about the different things, but I'm just essentially gonna tell you what you need to know. Turn to page 646. Plasmodium vivax, Schuffner dots. You'll see Schuffner dots. So if you look at, on the next page, 647, if you look at, mainly B, C, and D, those are those Schiznots or Schuffner dots. And, you'll see they're smaller, because if you look at Plasmodium malariae, those Schiznots and B, you see they're larger. Y'all see that? So they have the smaller dots. You need to know that. Smaller dots within the red cell. Okay.
I remember malaria, saying how it forms green.
Uh-huh. The next one is malariae. They assume a band form across the cell. So if you look at malariae over on 647, that band form is talking about on the outer of the cell. They have those schizonts, and you see they're much larger, forming a band on the outer edge. Y'all see that? Whereas Vivax was all inside. Y'all see the difference? Vivax was like schizonts throughout the whole thing. Malariae is just on the edge. You mean?
This one's the malaria, it's on the diamond dot.
No. The next one is oval. And with oval, if you turn the page to 648 and look at the trough, you'll see it's small within the red cell and in an oval. So oval. Huh? A. 28.31A. And then the next one is Plasmodium falciparum. Two things about Plasmodium falciparum. The trophozoites are in ring form. So if you see small rings, that's falciparum. And so that would be like figure A. Then figure B is the gametocyte, and it is like banana shaped, like a crescent. Y'all see that? So to differentiate all of these, 5X, small dots throughout the whole red cell. Malariae, big dots around the edge. Oval, the trough in the middle, you have an oval. And then falciparum, ring forms, or the gametocyte is crescent shaped. Everybody got that? And if you turn back to 646 under P falciparum, double chromatin dots, and then under other characteristics, crescent shaped gametocytes. So now Babesia. How do you get Babesia? Is it mosquitoes? A tick. So babesiosis is a zoonotic intraerythrocytic infection transmitted by the bite of a tick. You go a couple more lines. It's the Ioxides hard tick. It serves as the vector, and the white-footed mice and white-tailed deer are reservoirs. So malaria is intraerythrocytic, but by mosquitoes. Babesia is intraerythrocytic by ticks. Y'all remember what Babesia looks like? A lot of times it takes the shape of a what? Maltese cross. Yes. So if you look at 649, figure B, you can kind of see it. If you look at that one and figure B, it's starting to take on a Maltese cross pattern. Very hard to see. But you see, y'all see it? You got one at the top, at the bottom, and then on the sides. On the right side, you can barely see it. But it's there. Y'all see it? So Maltese cross. Go back to the reading on page 648. The next paragraph. There's over 100 species of Babesia, but Babesia microti is the main one in the United States. It is a potential threat to the U.S. blood supply because it is the most common parasite transmitted in transfused blood. Because, go down to the very last sentence, there are no FDA-approved tests for screening donor blood units for Babesia. The clinical infections, if you just read it, it talks about the same thing. It talks about you have flu-like symptoms, fever, chills, sweating, myalgia, all that good stuff. The life cycle, it just talks about how you get it, which is essentially the same thing. The salivary glands of the tick bites, and there you go. Laboratory diagnosis. The diagnosis of babesiosis is made from right or yin-sustained thin blood smears. The organisms appear as small, delicate, pleomorphic, ring-formed trophozoites with chromatin prominent chromatin dots and faintly staining cytoplasm. If you go down a little bit more, talks about figure B. It says it demonstrates a tetrad formation. So that's your Maltese cross. So make a note of that, Maltese cross for Babesia. And you need to know what Babesia looks like also. And you, if you have it on your test, you will be able to tell. Like it's not gonna look like a malaria. Does that make sense? Yes, it's gonna look better than these pictures. Same with the Giardia too. Yes, it's gonna be like you can tell, you know. Toxoplasma gondii. It is an obligate intracellular parasite found in mammals worldwide. Where do we get Toxoplasma gondii? Cat litter. So the house cat is the host. Remember that? Okay, so turn the page. Clinical infections. Clinical presentation based on the immunologic status of the individual. Immunocompetent patients with acute infections may be asymptomatic or just have mild flu-like or mono-like symptoms, but it's very different if a person has an immunocompromised system. Go to the next paragraph. The organism may be transmitted congenitally because of a transient parasitemia in pregnant women who have primary infection. It can cross the placenta and enter fetal circulation and tissues. Children who acquire T. gondii may have a range of serious complications, mental retardation, microcephaly, seizures, hydrocephalus, retinochoroiditis, and blindness. Next paragraph, immunosuppressed patients, especially those with leukemia or lymphoma or undergoing chemo, can experience very severe infection. The next paragraph, it can also be transmitted via organ transplantation. So go to the life cycle. Next paragraph. Humans can acquire T. gondii infection in several ways, such as through the ingestion or inhalation of the oocysts from soil or water, through ingestion of undercooked meats, primary risk factors for the infection include cleaning the cat litter box, gardening without gloves, and eating raw or undercooked meat or unwashed vegetables and fruit. The household cat and other members of the family of Felidae serve as definitive hosts for the organism. Go to lab diagnosis. 7 lines down. Tests for antibodies are most commonly used for diagnosis. So a kit test, not looking at it up under the microscope. Now you can, but that's rare. So turn the page, 652. Cryptosporidium parvum, Cryptosporidium hominis, and Cyclospora, the main one is belly. have been recognized as organisms that cause self-limiting GI infections in the immunocompetent host. They have been identified as opportunistic pathogens in immunocompromised hosts, particularly those with AIDS. All of these organisms are transmitted by fecal oral route, so the ingestion of contaminated water or food, or by direct contact with fecal material containing these oocysts. So laboratory diagnosis. So I already told you that you needed to know this, Cryptosporidium. The oocysts will stain pink with a modified acid-fast stain, and the background is blue. They're small size and they're round. They may resemble yeast or red cell. There are more oocysts are seen in liquid stool than in formed stool. Under lab diagnosis on page 653. The recommended detection methods are the modified acid-fast stain, an antigen detection test, so a KITS test, or a DFA test using monoclonal antibody directed against Cryptosporidium. With the acid-fast stain, the organisms stain a bright red or pink, which distinguishes it from yeast, because yeast stains green. So red, small circles, blue background for Cryptosporidium oocyst with an acid-fast stain. Turn the page to 654. Cytospora belli. It's an opportunistic organism less seen frequently than Cryptosporidium. It is only known to infect humans. Go all the way down right before the picture. Same thing. Modified acid-fast stain has been used to detect C. belli. The oocyst wall does not stain, but shows a faint outline because of precipitated stain. So if you look at this, they are bigger than Cryptosporidium. And if you look at the outer wall, you see there's like a blue outline. Okay. Because they do the wall does not stain. What you need to know about that one. I'll skip a good bit of these. Turn the page to 656. Helminths. So helminth infections in humans caused by flukes, tapeworms, or roundworms. Humans become infected by directly ingesting eggs, by ingesting larvae in the host, or through direct larval penetration of the skin. Adult forms do not multiply in the human body, so the number of adult worms present is related to the number of eggs or larvae that is ingested. So once it becomes an adult worm, that's it. It doesn't multiply from that, okay? But if you say you swallow 3 eggs, you're going to get 3 adult worms, That makes sense? The pathologic consequences and severity of infection are related to the number of adults present. Patients with only a few adult worms are usually asymptomatic, whereas if you have a large number of adults, you often show symptoms. So the flukes, or trematodes, as they're sometimes called, they are flatworms. So you have different types of flukes. You have intestinal flukes, liver flukes, lung flukes, and blood flukes. Okay? So intestinal flukes. Fasciolosis buski is known as the giant intestinal fluke. It is found in the Far East, including China, Vietnam, and India. Dogs and pigs are the reservoir hosts. Humans acquire the infection by ingesting metacarparia on freshwater vegetation such as bamboo shoots and water chestnuts. Adults in Fasciolosis buski live in the duodenum, where they cause mechanical and toxic damage. Heavy infections result in diarrhea, anorexia, edema, ascites, nausea and vomiting, and intestinal obstruction. Finding the adult or egg is diagnostic, although the egg is more commonly seen. So if you look at figure 28.42, that is what it looks like. You need to know that. Go down in the reading a little bit more. They are yellow to brown. They have a small, relatively inconspicuous operculum. They are unembryonated when passed. They're identical to those of Fasciolosis hepatica, so you can call them both, buski or hepatica, fasciola. But technically, the liver fluke is known as hepatica liver. Fasciola hepatica is the sheep liver fluke. Underline that. Sheep liver fluke. And go back, Fasciola buski, giant intestinal fluke. So hepatica is seen in sheep raising areas. A little bit more. In sheep, the organism causes a disease known as liver rot, which is characterized by liver destruction. Humans acquire the infection by ingesting metacarparia or raw water vegetation, especially watercress. There's the page. 3 paragraphs down. The Chinese liver fluke. C. sinensis, Clonorchis sinensis, Chinese liver fluke. Underline that. Is geographically limited to the Far East, where dogs and cats serve as reservoir hosts. So if you look at table 28.7, write these out to the side. So Fasciola hepatica, sheep liver fluke. Fasciolosis buski, intestinal fluke. we're about to talk about this one. Paragonemus westermanni, that's your lung fluke. And Clonorchus sinensis is your Chinese liver fluke. And then we're going to talk about the other ones. Schistosoma mansoni, Schistosoma hematobium, and Schistosoma japonicum. Hematobium is the only true urinary parasite. True urinary parasite for hematobium. Meaning that if you see it in the urine, because other things can appear in urine too, like trick, or you can see pinworm eggs in there, in urine. Okay, but is pinworm eggs, do they come from urine? No, it's contaminated from the blood, right? But Schistosoma hematobium is the only true urinary parasite. Okay, so then go back to the lung fluke. Or actually, go on the next page to figure 28.43. Know what Clonorchus sinensis looks like, that egg. And so to me, if you look at the top of that, you see a little protruding, looks like a pimple kind of, I guess you would say, like at the top. So it's shaped like a rose, kind of, like rose shaped. Are you thinking probably what I'm thinking? I bet you're probably thinking that, because when I see this, that's exactly what I think of. And it looks like it's gonna open.
I think I do, but I don't know.
It looks like it's gonna open at the top. It has like a pimple type thing protruding out. Y'all see that? So that's C. sinensis. The next one is Paragonemus westermanni. It's kind of football shaped. I don't really know how to. A what? A what?
Yeah.
I can't hear you.
Avocado.
Avocado. Oh, I could see that. Oh, yes, you need to know that. So it is known as the lung fluke. If you look right up under the picture, humans acquire this infection by ingesting metacariae in raw, pickled, wine soaked, or undercooked freshwater crabs or crayfish. And obviously, it's the lung fluke. What type of specimen are we going to see this in? Sputum. Go to the next paragraph. Sputum is the primary diagnostic specimen. So your blood flukes, which are your schistosoma species. If you go back to 658, that table, or really turn to 661, these are probably better, these pictures. You need to know all three of these. So, how you determine these three. Out of the schistosomas, Schistosoma japonicum is the only round one. and it has like the middle part, and then like the outer part is smooth, kind of. It's round. Well, then the Mansoni and the Hematobium. So, we'll kind of talk about them a little bit. But Schistosoma hematobium, like I said, is the only urinary one. And y'all remember me telling y'all that story about my husband and studying, and the girl come up and said what she said, that she had itchy coochie from the river water. Okay. And he was like, well, she has Schistosoma hematobium. And still to this day he talks about that. But anyway, so how I look at these, how I kind of remember these, is hematobium has a lateral spine in the back, like the very end. Y'all see that? So B is hematobium. So they're both like football shaped, but hematobium is, I think of like itchy coochie. Coochie's like at the bottom. So like that's why I remember that little spine is. And then the other one is Schistosoma mansoni, which has a spine out to the side, and you know, men can rise to the side. Sometimes you've got to remember these a certain way. And trust me, these were on my registries. So that's how I remember them. Mansoni has a spine out to the side. Y'all see that spine, that like needle-like thorn out to the side. And then hematobium is at the bottom, at the end, where the itchy coochie is taking place. So if you turn back to the reading, blood flukes, both male and female forms exist. And go down the 2 bullets. Humans are infected by direct penetration of the skin. There are 3 of them: Schistosoma mansoni, Schistosoma hematobium, and Schistosoma japonicum. Go to clinical infections, second paragraph. Egg production and egg migrations throughout the tissues are responsible for the immediate damage because the eggs are highly immunogenic. After release by the adult female, the eggs secrete enzymes, begin to penetrate vessel walls and tissues. Eggs find their way into the lumen of the intestines or the bladder. The egg spines, so those things sticking out, cause trauma to the tissues and walls of the vessels early during the acute stage of infection, and can result in microscopic hematuria in hematobium, because it is urinary, or diarrhea with Mansoni and japonicum. Everybody got that? Turn the page to lab diagnosis. Diagnosis is made by finding the eggs in feces. So in feces, it's going to be Mansoni or japonicum. Or in urine, that's hematobium. The egg of Mansoni is yellowish, elongated, and has a prominent lateral spine. Hematobium is elongated and has a terminal spine, and the japonicum are round. So then, your tapeworms or your cystos. 4 or 5 lines down. They are ribbon-like organisms whose method of growth involves the addition of segments or proglottids. Each proglottid, when mature, produces eggs infected for the immediate host. The anterior head-like segment of the tapeworm is called the scolex, and it has suckers on it. Those suckers, or they literally, if you probably turn the page, if you turn to 662, so you see those segments that is in like squares, those are proglottids, okay? And then if you go up, the head part is called the scolex, and then it has those suckers on it. Those suckers also contain, well, these are tapeworms, but they said are to contain hooklets, but really the main one who contains hooklets is the hookworm. So they literally have like, it looks like teeth, but it's not teeth. Like they hook into you. But with tapeworms, they have these suckers, and that's what attaches them to the intestinal mucosa. And then go down a little bit more. Gravid proglottids at the distal end of the organism is what discharges eggs into the feces. So if you look, turn back to 662, the gravid part, which is the very end of the proglottids, if you're seeing a live tapeworm up under a microscope, you can literally see this happening in real time, where the gravid part is, you can zoom in on it, and it literally, you can see it moving, and you can see the eggs being dispersed onto the slide. It's nasty. Go to page 661, 3 lines down. The diagnosis of tapeworm infection is usually made by finding eggs in the feces, although proglottids can be used if passed intact. So Diphyllobothrium latum, D. latum, is the fish tapeworm. It is found worldwide in areas where the population eats pickled or raw freshwater fish. If you go down a little bit more in the reading, it talks about the symptoms. Usually you have vague GI symptoms, nausea, vomiting, intestinal irritation, can cause B12 deficiency. So then you have the Taenia species. You have Taenia saginata or saginata, which is the beef tapeworm. And then you have Taenia solium, which is the pork tapeworm. If you turn the page, um, 28.49, Dibothrium latum. You need to know what that looks like. So that is your fish tapeworm. If you turn the page to 664, this is just Taenia species. So with them, it has like an inner an inner and an outer portion. The outer portion is usually dark, and you see how really that outer portion kind of has like a rope-like structure to it. Yeah. That's Tinian species. Huh? No, that one too. So, you turn back to 663. So this is talking about the Tinian species. If you go up under figure 28.49, that next paragraph, embryonated eggs are passed in human feces and then ingested by the host. And if you go to the next paragraph, lab diagnosis of Taenia infections can be made by finding the egg, the scolex, or the proglottid in the feces. Hymenalepsis nana is the next one. It is known as the dwarf tapeworm. And this, like I told y'all, this is already outlined for you pretty much in your Pointsy cards. It tells you all of these. Like your Pointsy cards are going to be a great source for this. So it is the dwarf tapeworm, and it's the most common tapeworm in children. So this sounds bad, but think dwarf, little people, children. Okay. You got, I'm telling you, you just got to remember these this way, or that's how I do. I don't know. Y'all do you, but that's how I remember some of this stuff. Because they all run together. They'll all run together. You got to have some stuff to differentiate them. So turn the page to 664. Light infections are usually asymptomatic. Large numbers of worms can cause abdominal pain, diarrhea, irritability, and headache. H. nana is easily transmitted among children. Direct fecal oral transmission of the egg, development of the cyst in the intestinal host, and reentry into the lumen for development up to the adult is the life cycle. The caninum or caninum, that's the dog tapeworm. Children are usually infected by ingesting fleas containing the larval stage. Yep. So caninum, so canine, dog, okay, dog tapeworm. Turn the page. Roundworms. So human roundworms include those that infect the intestinal tract and blood and tissue. These organisms, which are found worldwide, are transmitted by the ingestion of embryonated eggs or by direct penetration of skin by larvae in the soil, and they may require an insect vector. Intestinal roundworms are the most common of all the helminths that cause human infections in the United States. The infected individuals are usually found in highest numbers in warm, moist areas of the southeast and areas with poor sanitation. Roundworms are characterized by the presence of two sexes, a male and a female, and a life cycle that may involve larval migration throughout the body. The adults obtain nourishment by absorbing nutrients from partly digested intestinal contents or by sucking blood. So, Enterobius vermicularis, it is the pinworm. It's the most common parasite detected worldwide, especially in children. Key risk factors are inadequate personal or community hygiene. Enterobiasis, they're frequently found in families, kindergartens, daycare centers, and crowded conditions where eggs can be easily transmitted. Go down a little bit more. It says there is evidence that the organism can also be associated with urinary tract infections in young girls. So if you turn the page, I told you you needed to know what this looks like. Enterobius vermicularis, the pinworm. Page 668. Although patients with Enterobius vermicularis infection are often asymptomatic, except the itching, they can experience loss of appetite, abdominal pain, loss of sleep, nausea, and vomiting. Anal itching is caused by migration of the female worm to the perianal area where she lays her eggs. Okay. Go to the next paragraph. Because eggs are laid outside of the body in the perianal area and are rarely present in the stool, a fecal specimen is unsatisfactory for diagnosis. You are going to use the cellophane tape method. It must be done as soon as the child arises in the morning. The perianal area is touched with the sticky side of the tape or the paddle. The adult female can occasionally be seen in this preparation. Because the gravid female can migrate into the vagina, eggs can also be seen in vaginal specimens. Have y'all seen, funny thing, and I shared it on my Facebook, but the ones who don't know, and they're like, what the heck is she talking about? But have y'all seen that commercial for, oh my God, what's that tape stuff? Yeah, I think it's Flex Tape. Where he's going like that or whatever with the Flex Tape, the Flex Tape says like it's on there. And so it's the guy, the Flex Tape guy or whatever, he has the Flex Tape and it says something about kids itchy butthole, and then it had the man doing the Flex Tape, and I like thought that was so funny. And then like my lab tech friends thought it was funny, and then other people were like, what the hell is she talking about? Because just they don't know. But that was so funny to me. Anyway. The next one is Trichuria. If you go up to the next paragraph, it is the whipworm. Whipworm. It likes moist, warm climates. It is found in the southeastern United States and usually a co-infection with Ascaris. Light infections with Trichuria rarely cause symptoms, but it can cause bleeding, weight loss, abdominal pain, nausea, vomiting, chronic diarrhea. If you look at figure 28.58, you'll see that Trichuria think of it as like it's, okay, that's the same name as the first and last name, right? Trichuria. So same name, you got two pimples on both ends. Same name, two pimples on both ends. Obviously they're not pimples, but that's just how I remember it. The next one is Ascaris lumbricoides. More than 1 billion people worldwide are infected with Ascaris. The organism can be found in tropical and temperate areas, and children are most commonly infected. In the United States, the organism is most frequently seen in rural parts of the Southeast. Rural parts in the Southeast. It is by fecal oral routes. If you turn the page, Ascaris, that is what it looks like, and you need to know what it looks like. But to me, this sounds horrible, y'all, and I'm sorry, but it's just how I remember stuff. Sometimes you know how poop can be bumpy, like bumpy poop, like hard poop. Y'all ain't, yeah, okay, y'all ain't gonna let me. So do y'all not look at y'all's poop? Like that, yeah, let me tell you, if you ain't looking at your poop, when you use the bathroom, start looking at your poop, because your poop can tell you so much about what is going on with your body. Do you have fat in there? You can see the fat globules. That means you need to lay off the cheeseburgers, okay? Or you might have some type of maldigestion or malabsorption issue going on. Does it smell like oil? If so, that's also fat, okay? Is it regular brown colored or is it like clay colored? If it's clay colored, you might have some obstruction, something going on. If or something with your gallbladder. Is there blood in there? You might have a GI bleed, or it might be hemorrhoids, or it might be something else. Start looking at y'all's poop. Is it loose or is it hard all the time? If it's hard all the time, you need to start drinking some more water. If it's loose, then, you know, good for you. I need to start looking at y'all's poop. For real. But anyway, so Ascaris lumbricoides to me, I don't know. It's found in poop and it looks like bumpy poop. I don't know. That's just how I remember stuff like this. I don't know. But anyway, you need to know what it looks like. We're gonna finish this today, but not right now. Because y'all need to go ahead and start studying and making outlines and everything for this. So I want to go ahead and put it out there so that you can start studying. But we'll stop right there, take a break, go get you something to eat, go to lunch in 30 minutes. We got stuff to do. And 669 hookworms. Hookworm is one of the most common human parasites. Close to 1 billion people are estimated to be infected worldwide and in the United States. Hookworm infection is the second most commonly reported helminth infection. Unlike other helminths, in which infection peaks in childhood and adolescence, the hookworm burden often increases with age. There's 2 species of hookworm. Necator americanus, which is the New World hookworm, and Encyclostoma duodenale, which is the old world hookworm. A duodenale or duodenale is seen in southern Europe and northern Africa, as well as parts of Southeast Asia and South America. And Decatur americanus has been Africa, Southeast Asia, and South and Central America, and is endemic in rural areas of the southeastern United States. Next paragraph, 3 lines down. They live in the small intestine and attach to the mucosa by means of teeth or either cutting plates. They digest the tissue plug and pierce capillaries. Once attached, they continue to ingest blood as a source of nourishment by secreting anticoagulants, platelet inhibitors, and substances that interfere with factor 7A tissue factor complex. The organisms also secrete substances that interfere with the action of digestive enzymes and inhibit most absorption of nutrients. Some clinical symptoms. One of the things is a small red itchy papule referred to as ground itch at the site of larval penetration. Underline that. Ground itch, which is a small red itchy papule at the site that the larvae penetrated, however it penetrated.
I thought you ingested those.
Now you can get hookworm by stepping on hookworm eggs also.
Okay, so that's why because my dog had hookworm, and they told us to make sure we cleaned up their poop and stuff. out of the
You
yard.
get hookworms, dogs get hookworms from soil. Page 671, when the eggs have been deposited in warm, moist soil, the non-infective feeding first stage rhabditiform larvae develop within 1 to 2 days and then feed on bacteria in the soil. A non-feeding infective faleriform larvae develop within a week, and then humans are infected when the faleriform larvae penetrate the skin. Next paragraph. Adult hookworms are rarely seen in stool specimens. The egg and the rhabditiform larvae are the usual diagnostic stages. The eggs and larvae of the two species are indistinguishable, so the lab report can only demonstrate or only say hookworm. So if you look at 28.62, that is a hookworm egg. You need to know what it looks like. And think of it as like an egg, and then like in the middle is like eggs inside of an egg, kind of. Hookworm egg. And then real quick, if you turn to page 672, this is the hookworm, like as seen as a worm. And if you look very closely, you can literally see the mouth on it. It has a buccal capsule. You don't need to know what this looks like, but I just want to show you that it can be as larva, like as a worm, or the egg, and most of the time you see the egg instead. Strongyloides stercoralis, that is known as the threadworm. It inhabits the small intestine, but it is capable of existing as a free-living worm. Go down 4 or 5 lines. It can persist in the host for decades after initial infection. An infection may progress to a hyperinfection if the patient or the host becomes immunocompromised. Next paragraph, next page. Most patients are asymptomatic. However, they may exhibit fever, nausea, and vomiting, tracheal irritation, sharp stabbing pains that resemble that of an ulcer or other GI diseases, including pancreatitis. Chronic mild diarrhea and eosinophil count is often elevated. Go directly across to that paragraph. The life cycle can take 1 or 3 phases. Direct, which is similar to that of a hookworm. Indirect, which involves a free living phase, or autoinfection. In the direct life cycle, the fertile egg hatches in the intestine and develops into the larvae, so into the worm, which is then passed in the feces. In the soil, the rhabdiform larvae develop into falciform larvae, which are ineffective for humans by direct penetration. But once the larvae has penetrated the skin, it can enter the blood circulation, go up break out from the capillaries in the lung, migrate up the bronchial tree and over the epiglottis, and enter the digestive tract, where it then matures into an adult worm. Or the indirect cycle, it is in the soul and it develops into a free living male or into females that either produce eggs. Next paragraph. The threadworm is small and is rarely seen in stool specimens. No male has been identified in intestinal infections. The primary diagnostic stage in humans is the rhabdiform larva. Go down a couple lines. The egg, which is rarely seen except in cases of severe diarrhea, resembles a hookworm egg. So if you look at figure 28.65, you're going to see the worm form. Okay, so that's what it looks like. A and B. Yes. And if you look at A, because you can't really see it in B, it has a very short buccal opening. Y'all see where it looks like a mouth? Very short.
So is that the only difference between a hookworm and that, the way they look,
Pretty much.
is their mouth wide open?
Mhm. Yeah, and hookworms have like little hooks. So turn the page. So then you have blood and tissue roundworms. So trichinosis is the infection of muscle tissue with Trichinella spiralis. So Trichinella spiralis, muscle tissue. Put those two together. Humans acquire the infection by eating undercooked meat, particularly pork. In recent years, ingestion of wild game has led to infections by other species of Trichinella. Go to the next paragraph. During the intestinal phase, the infected individual has few symptoms. Diarrhea and abdominal discomfort may be present. But then go down like 4 lines, 5 lines. Common symptoms: fever, muscular pain and tenderness, headache, and general weakness. Also, muscle enzyme levels may be elevated. What's a muscle enzyme? The main one. Yeah, myoglobin could be. What's another one? Oh, yeah. But what did you say? CK? Creatine kinase? Okay, it's like your main muscle creatine kinase. And if you look at 28.66, that is a biopsy. And so, if you look, it appears to be encapsulated. Y'all see that? So this is a biopsy of muscle tissue. And do you see the actual worm in the middle? It appears to be encapsulated. See that? Okay. Larva migrans. There are two forms that exist in humans, cutaneous and visceral. And add a little bit more. In the United States, cutaneous larva migrans occurs in the Southwest, Mid-Atlantic, Gulf Coast areas, and is more commonly caused by the falciform larvae of the dog or cat hookworm. So in other words, what this is saying is your dog can poop out hookworms, or your dog can poop. You step in the poop, it has active worms in it. The worms can penetrate your skin and climb up your feet and into your legs. Let me show you what I'm talking about. Just in it and group me. Is where literally the worm is crawling up in your skin.
Oh, God. Gotta stop showing myself like this. I swear, ever since you showed us that thing with the Apple Watch. Yeah.
Me too.
I've been like,
I go like this.
I
I
know,
take it off and then I go like.
I just be like lifting my up and checking for a ring.
So the larva penetrates the skin through a hair follicle or a break in the skin or either unbroken skin. Once inside the body, it does not enter circulation but wanders through subcutaneous tissue, creating long, winding tunnels. Secretions from this larva create a severe allergic reaction with intensely itching skin lesions that are vascular and erythematosus. Secondary bacterial infections usually result from scratching. So in visceral larva migrans, and this is the next paragraph, a human accidentally ingests the eggs of the dog roundworm or cat roundworm. So meaning you have sat there and gotten poop, dog poop or whatever on your hands somehow. I guess, let's say it's a little dog. Little dogs can get hookworms. You go and clean up the poop, didn't think about it, and was like automatically like went like that or something, and like leaked your hands and it got on your, you know, your lips, and then you went like that, and it's just that easy. Okay, so wash your hands. A human accidentally will ingest it. The larvae hatch in the intestine, penetrate the intestinal mucosa, and wander through the abdominal cavity, can enter the lung, eye, liver, or brain. Infection is seen primarily in children 1 to 4. Filarial worms. Filarial worms are round worms of blood and tissue, primarily found in tropical areas of the world. There are several species, and we're gonna talk about them. Go to Wikiria bancrofti. The causative agent of Bancroftian filariasis and elephantitis. It is primarily limited to tropical and subtropical regions. And let me show you a picture of this. And you've probably seen this on like documentaries or stuff like that. And you not realize that what it is. Everybody got it?
Sorry.
I don't know what is going on with the service. So it causes elephantitis, which is essentially like has to do with your lymphatic system. So the insect vector is a mosquito. You can actually, it not only affects their legs, but can affect men's scrotums too. If you Google elephantitis on a scrotum, like the scrotum is literally like,
Not where the mill is.
yes, but
Spider.
like 10 times worse than that. The insect vector is a mosquito. The adult filarial worm lives in the lymphatics and the lymph nodes, especially in the lower extremities. Get out a little bit more. A strong granulomatous reaction with production of fibrous tissue around dead worms will then ensue, and the resulting reaction causes the lymphatics to become narrow and closed, causing leakage of fluid into the, leakage of fluid into the tissue. Good Lord. Causing that tissue to then swell. During this period, the patient may experience generalized symptoms, fever, headache, chills, swelling, redness, and primarily at the sites of male and female genitalia and the extremities. So if a mosquito bites you, can bite you on the extremities, the female and male genitalia with Wikiria bancrofti. Elephantitis, underline that, is a debilitating and deforming complication. And that's what you just saw right there. That's what it causes. Go down 4 lines. Diagnosis should include the examination of a blood specimen obtained at night for the presence of microfilariae. So W. bancrofti, mosquito, elephantitis. Loa loa. It is known as the eye worm. It is limited to the African rainforest where the fly vector, the Trisops breeds. Adult worms, which may live for as long as 15 years in humans, migrate through the subcutaneous tissue, causing temporary inflammatory reactions. Go down 4 or 5 lines. The adult worm can often be seen as it migrates across the surface of the eye.
I watched that. Where is it? My Trip to the ER or something. like that, and
Monsters Inside Me.
It might be, and it showed it.
I love Monsters Inside Me because this is what it's all about. Let me send you a picture of Loa Loa. And y'all are probably gonna be like, ooh. Or it's several pictures, but anyway, get the idea. Okay. This is
Oh,
it.
hell. Susan knows.
Don't do the brown part.
My eye's itchy.
I know, mine too.
So Loa Loa is the eye worm. The next one,
I'm just
seeing-
I'm gonna be checking my feet all the time now. I'm gonna be looking at my eyes all the time.
oh no. The next one, oh, and figure 28.68, the Wucheria bancrofti, which is what causes elephantitis. You need to know what it looks like. This essentially worms, or the adult worm, and it almost looks like, so that's a stain, against a stain, and that's how you're gonna find it, and that's what it looks like.
Oh, it's like a nerve root.
Oh,
You know, little nerve root.
yeah.
Do you know that picture from your picture?
Yeah. The next one is Onchocercia volvulus. Go a little bit, river blindness. It is found in Africa and South Central America. Transmission occurs by the bite of the black fly. So ovolvus river blindness. No. The next one, and the last one. It would be nice.
Like,
wouldn't it?
you make me wanna go get dragonfly alarm, we'll put it in my pond, so I have a bunch of dragonflies in it.
I will send this picture to you.
Oh, Lord.
Not that picture. Talking about Morgan Lawn lawn tickets. Don't need to know that. So while it's waiting to come across, it is known as the guinea worm.
Which one are you on?
Draculensis medinensis. Draculensis medinensis. It is called the guinea worm. And it causes serious infections in the Middle East, parts of Africa and India. Go to the next paragraph. Adult worms mature in deep connective tissues, and the gravid females migrate to the subcutaneous tissues. Initially, a painful blister-like inflammatory papule appears on the leg or in the area where the gravid female is present. So if you look at this one, you see that big papule that I sent you. Y'all see it in group me? So then the papule ulcerates, and when the body comes in contact with water, the female worm exposes her uterus through the ulceration and releases the larvae into the water. Patients may experience nausea and vomiting, urticaria, and dyspnea before the rupture of the worm's uterus. If the worm is broken during an attempt to remove it, the patient can experience a severe inflammatory reaction and a secondary bacterial infection. Humans acquire the infection by ingesting a copepod that contains the infective larvae. Next paragraph. The diagnosis is made from the typical appearance of the lesion. Although organism-specific antibodies develop with the infection, immunity does not develop, and an individual can be infected multiple times. And what I'm about to talk about is what's in the picture right here. Flagella's given for treatment. The ancient method of removal by rolling the worm a few inches at a time onto a stick is still practiced in some areas of the world. So that's what they're doing in this picture. They have taken a stick, wrap the worm around it, and literally roll it and keep rolling it a little at a time so that the worm rolls out and rolls onto it, and then you're free of the worm. No, that is a worm. Huh? That is one worm right there. And they've just sat there and rolled it like this. And so.
Why would you roll? Why would you pull?
Because it can break. If it breaks off, then they're gonna have a severe reaction. You need to roll it slowly so that it'll roll out and continue to roll. And then it's like a spaghetti noodle kind of. If you pull like that on a spaghetti noodle, it's gonna break. But if you constantly go like that little at a time, it ain't gonna break. Oh, you just wait. Like I can hardly eat spaghetti anymore because every time I look at this spaghetti noodle, I'm like, it looks just like worms. Wait till y'all get in the lab and y'all get a patient with like true life worms. Y'all gonna be like, that's this chapter.
What do you think this test is gonna be?
Probably Monday.
And that's this micro.
That's micro. Yay! So know the pictures that I told you to know. How many specimens should be collected? 3. What does viewing like a macroscopic tell you? Macroscopic. Intact worms called proglottids, and the consistency. So how it looks. Is it formed? Is it loose? Is it soft? Whatever. For the macroscopic, you cannot see eggs. Eggs are microscopic, okay? So for macroscopic, you cannot see eggs. So, a stool should be examined within 2 to 3 hours if held at room temperature. How long do you have if you refrigerate it? 24 hours. What method do you identify oocysts? Or as a fast thing? Whenever you're looking at a microscopic, you scan it on what power field? 10 or 40, and then you identify it on 100. What do you use cellophane tape for? Not a pinworm. It is a pinworm, but what's the name for a pinworm? Okay, I'm gonna be like, it's like Spanish. Learning Spanish in high school. Can I go to the bathroom? No. Baño, yes. See, you can. Okay, so tell me, the scientific thing. Make sure that, if I told you, like what it went with, like Loa Loa, eyeworm, W. Bancrofty, blah, 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 da, 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 da. Know those correlations, okay? Your Polanski cards, literally, they are in there. Are they not, Shelton? Because I saw you looking at them. They are there. It's right there, right in front of you. Entamoeba histolytica and Entamoeba coli. Entamoeba histolytica has chromatoid bars that are what? Rounded. Entamoeba coli has how many nuclei? 8. What is Neisseria or Naegleria fowleri? Brain-eating amoeba. What's the only ciliate?
E. coli.
E. coli, Balantidium coli. What flagellate is found in urine and has a jerky motion? Trip. Which is a intestinal pathogen that has a falling leaf motility and looks like an old man with glasses? Giardia, Lamblia, or duodenalis, whatever.
When you say either of them,
Yes. What causes sleeping sickness and is transmitted by the tsetse fly? Yep. What's the trypanosoma that causes Chagas disease in the United States? Trypanosoma cruzi. What does it look like?
worm.
A theory, yeah, worm. Plasmodium causes what? Malaria. There's 4 of them, which are what? Malaria. With Vivax, they are like smaller dots and are spread throughout. The malariae, the dots are like around the edge. With oval, you got that one single oval thing in the middle for the most part. And then falciparum, either ring form or their gameta site is crescent shaped. But and how is it spread? The bite of what? Mosquito. Babesia, bite of tick. Babesia, what's the species usually? my karate. And usually it is, intracellular in the red cell and has a what formation or characteristic? Maltese cross. Which organism has oocysts that stain a bright red with an acid fast stain? Cryptosporidium parvum. What's the giant intestinal fluke? Booski is the intestinal fluke. What is the sheep liver fluke? Hepatica. What about the Chinese liver fluke? Sinensis. What about the lung fluke? Yep. Which is also located where? What type of specimen? Sputum. Going back to malaria, you're going to do what by looking at it? You're gonna make two smears. They should be what? You should make this kind of smear and this kind of smear.
Thick and thin.
Thick and thin. The thin smear is just like making a dip, and the thick smear is just dropping a drop of blood. Which schistosoma has a terminal spine? Terminal meaning like the back end. Hematobium. Which one has a lateral spine, which means on the side? Mansoni. What does japonicum look like? Okay. Oh, and then going back, which we're gonna go over all these again anyway, because I mean, y'all have the we. Really want to change it to Thursday.
Like this person?
But I'm probably not. I'm probably gonna be nice.
Any questions you want to?
There are 55 questions. So 1.8 apiece. The multiple choice is the pictures. Then you have couple more multiple choice, and then you have matching.
And then
So I mean, it's no fill in the blank, so it's really not that bad. It's just just memorizing. I'll take that back, there's 4 fill in the blank, only 4.
You like spelling things out or just.
The 4 gifts. There will be a genus and a species, so. I know, that's the only thing.
What? What's the other thing?
What's the fish tapeworm? What's the beef tapeworm? Which one? Yep, which one's the pork tapeworm? And what's the dwarf tapeworm? Yep. What's the dog tapeworm? Mm-hmm. Then you have roundworms, under roundworms, Enterobius vermicularis, which is the pinworm, that should be easy. Trichuris trichuria is the whipworm. Ascaris lumbricoides, that's just a roundworm in general. Whenever you hear Ascaris, just put that with a roundworm. 'Cause, I mean, it is a roundworm. Then you have hookworms. You have 2 hookworms. The New World hookworm, which is, yep, and then you have the Old World hookworm, which is, yep. Strongyloides is the red worm. Trichinella spiralis is located where? Huh? Muscle tissue. Loa loa is the eyeworm. Fouquiera bancrofti causes what? Elephantitis. Onchocerca volvulus causes river blindness. So y'all pretty much, I mean, if you memorize those together, now you get it. It's straight memorization, this chapter. That's all it is.